Good morning, everyone. Welcome to the new episode of Blueme, Smell the Zen. Today, we have the pleasure of inviting Dr. Paule Joseph. She's the director at the National Institute of Health Center for Smell and Taste. Dr. Joseph, very nice to see you again.
Hi, May. Nice to see you. Thanks you for having me on your podcast. This is going to be a very exciting conversation.
It's a very interesting conversation, particularly after a very hot summer. I was in Paris last week, and smell is definitely on my mind when there's no AC. So I couldn't tell you how excited I am thinking about what we can discuss today. So you and I were introduced by a common friend, and she knew how passionate you and I both regarding the topic of smell, although we have very different background. What struck me is that my reason for the smell came out of my 30 years working in the fragrance industry. When I worked as the CEO of Chesapeake Bay Candle, we work with the big companies like Target, we work with Bed Bath & Beyond, Kohl's, and whenever there's a announcement of a hurricane or natural disaster, we would get panic calls from buyers from those stores and say, we need to reinforce our shipment. And I would always be curious why they're not reinforcing tea lights, for example. They're reinforcing some of our most expensive fragranced candles. So one of those focus groups interviews, I asked questions. I remember it was in Florida. We usually carry those focus groups a few times a year to understand consumer and shopping habit. I would go with the buyer and their team, and we ask people, when you go to buy emergency items for your home, when you know you're going to be moved into a school or another shelter for a couple of weeks, why do you not bring a flashlight? Why do you buy fragrance candles? And what they answer always strike me. They say, well, we know that we can't control the weather. We don't even know if our house would be standing. As you know, a lot of the storms really wiped out houses in Florida. There's so much uncertainty. Therefore, we wanted something that we know is there for us. We want the same fragrance we use each day to be with us so that we can burn them or just smell them, opening the jar and take a sniff, and it immediately calms us because it reminded us of the normal days, life and comfort. And even at that time, I told myself, we thought we're doing something not the most urgent or the most vital in society. Yet, maybe that was wrong. What we do indeed matters. In time of hardship, of uncertainty, what we did is provide a sense of mental health. I wasn't quite sure how to call it. I was not as focused on that. It really struck me the moment I was hearing it, but every single time there are other urgencies that just come and go, and it doesn't stand and stay with me. So what was your reason for smell?
I'm just listening to your story about, those early observations that you had about smell and the comfort that the consumers actually described. And, we're going to get into this a little bit later, but the importance of smell and memory, and as well as the sense of well-being. But for me, I am as you mentioned, I am the co-director for the Smell and Taste Center at the National Institute of Health. I have been doing work around this area for a number of years now. But I trained initially as a nurse and as a nurse practitioner. So how did I come into the area of studying smell, and why did I think it was important? First of all, I think back of the patients that I see, that I see now, and the patients that I used to see as well. I worked with patients that had bariatric surgery, weight loss surgery.
Right.
So, Re-and-Y and those sorts of surgery. And one of the things that the patients often said to me was like, food just didn't taste the same. But back then, we're talking about like early 2000s,
Right.
I didn't know as much as I knew now, as I know now, right? Where now we know that we have taste receptors in the gut, and that maybe this rewiring of the gut will also change the signals into the brain. But many of those patients will report that. So I didn't know better. So I will tell the patients, I think it's the anesthesia, things will get better.
Right.
It will, you will start tasting things again. But it didn't necessarily happen that way. So, but not only that, I also worked in nursing homes. And one of the things that I noticed in the nursing homes were that often we as nurses will get the medications and we'll crush it and mix it into applesauce to give to the patient. And then they will often spit it out, or they don't want to take it. And then I was really curious as to why. Again, I didn't necessarily have the knowledge that, our sense of taste will actually diminish with age, right? And the importance that smell and taste had for nutrition and for the things that we choose to eat. So I became very curious because I said, one of the things that connects us as humans is food, right? It's our ability to engage in community. There's always food around when we have activities.
And it's a common and shared experience that connects people.
Yeah, so I wanted to understand, how taste and smell vary in populations, because we also need to think about culture. There's certain smells and certain tastes that might be very common to me, but might not be common to you
like
or to
cheese.
other people.
People always use cheese as an example.
Exactly.
For the Europeans, cheese, the blue cheese in particular, it's such a delicacy. And then if you take them to Asia, to China, people hated that smell. So it's very culture bound.
Yeah, there's a lot of culturally bound things. So for me, I was just really interested in understanding those individual variations around smell and taste. So actually, my PhD dissertation was really focused on understanding how taste and taste receptors change, or, inform what kids eat in terms of sugar, right? And how that was related to abdominal adiposity and obesity in kids in particular. And of course, after I came to the National Institute of Health, I expanded my program of research to study metabolism in general. So how different diets change our ability to taste, how these different diseases impact our ability to smell, like, for example, alcohol use disorder, Parkinson's disease, and Alzheimer's. So my lab really is focusing on really understanding smell and taste and how it gets impacted by disease, but the importance that they have in our well-being and longevity.
So it's interesting you mentioned Alzheimer's, and I think you know by now how I got this business called Blueme started. It was because my dad came in his 50s to visit me and lived with us actually for a year. We would be going to Starbucks coffee, and he would be putting 5 bags of sugar.
Wow.
And I remember him laughing and say, American sugar is not sweet. And I would be putting 1 bag in my coffee and say, no, Dad, it's not American sugar, it's you. And I didn't know what I knew now, which is that the loss of smell and taste could lead almost 20 years before a diagnosis of Parkinson's, which eventually my dad was diagnosed. So this is one reason you and I, as soon as we discussed many years ago, we focus on the idea of a smell test. Can you share with me why is it that we have such advanced evaluation for your eyesight and your hearing? In fact, every year when I do my physicals, right, I have to do a very comprehensive battery of tests. Why is there no such a standardized test for smell?
That's such a great question, May. So, we live in a very audio and audiovisual culture. And, when we look historically, we have put a lot of emphasis, for example, on vision. But you can think back at points of Aristotle, right? Mm-hmm. Where, the word of God had to be heard and
to be real.
Yes, and we have to
Or to be seen.
We have to see certain things. So from a cultural perspective, we have put a lot of emphasis into these other senses. You know, we think about vision, hearing, we think about pain. You know, as a nurse working in a hospital, I remember going around and asking the patients, you know, do you have any pain right now? Every 2 hours, we assess these things. But when it comes to the sense of smell and the sense of taste, we don't. There's also the training that we get clinically is very minimal. It's often a chapter in our clinical textbooks in training. So we have a lot of clinicians who are not entirely fully trained on how to assess the sense of taste and smell. So this is one of the reasons why we have been extremely focused on providing knowledge to clinicians on how do we assess the sense of smell. Currently, we have a lot of tests that are used in the area of research. We have other challenges as well because we need standardized tests. We have some of which have come about because after COVID, right? So during COVID, we had some individuals and institutions have developed some tests that could be smelled for screening. We have had the sniffing sticks, which is literally like pens, like the ones that you have here.
But made
like,
up of felt.
When a felt in, we
Right.
had different odors, right?
Right.
And then we let people actually smell it. Mm-hmm. And those particular ones have different areas. We look at identification, discrimination, mm-hmm. right? We look at intensity. Mm-hmm. And we also have scratch and sniffs. And just
Right.
for the audience, think about the scratch and sniffs, like the scratch and sniff stickers that you get your kids that have an odor.
Right.
So those type of things,
Right.
right? But there's a distinction between screening and diagnosing and a diagnostic test. Right now, what you mentioned in terms of your dad, you know, for smell is a signal. Like the smell loss and decay of the sense of smell is a signal. Mm-hmm. You know, it's not necessarily a diagnostic, right? It's not
Right.
necessarily going to say because you lost your smell, you will get this
equals
disease,
to, right?
Right,
It equals
but
to, right.
it is an early sign, and that's the very important distinction. Is that early sign tells us a lot about how our brain is functioning.
Right.
So, to your earlier question as to why we haven't paid attention to society in society is primarily because we have truly focused on getting our vision done every year.
Right.
Right. And when we go to the doctor, I mean, I am a practicing clinician and I think about this all the time. I measure blood pressure.
Right.
Right. I measure pain.
Right.
I ask people about their hearing. I obviously ask about their sense of smell, but many clinicians don't. So I often tell people, when was the last time you had your sense of smell measured?
Right.
And the answer is often none.
Very interesting. And since then, you obviously have, because of COVID, all of a sudden, the world wake up to smell or not smell the roses.
Yes.
And I love to use that because smell the roses are often considered the kind of activity you do leisurely.
Yes.
It's not a priority to smell the roses. Now we realize if we can't smell the roses, that's bad news. So since then, obviously, you were also, and congratulations for leading our country's science and medicine in the area of smell and taste, which is so incredible. You and Dr. Levy, who I have the pleasure of meeting and working with, have been leading us as a country to consolidate more scientists, more researchers, more doctors in ear, nose, and other field, neurologists, people that had brain cancer so that they lost their sense of smell, trauma patient, on and on, to combine all these knowledge of all these fields. But the one thing I was very fortunate is that I was the only one coming to your launch of the center as the industry. Because what I didn't tell you, I told you, but many people didn't realize that unlike the scientific world, the fragrance world do train a lot of our own. In fact, that's a must. You can't hire anybody to work for a reputable brand or fragrance house without first knowing how good their noses are. And we call them the nose because it's that important, right? So we give them batteries of tests on the ability to identify as well as tell the strength of a fragrance. And then, even after that, they get training every single day to tell whether a candle smells good in the cold, or if its same character can be translated and carried straight into hot. That's what we call the hot throw and the cold throw. And we use this house with so many bedrooms and bathrooms for exactly their purposes, so that consumers get very good results at the end of the day because it went through such rigid tests. And I feel there's something that we in industry can offer for that effort of smell loss and smell test. So, but one thing that I would want you to share more, because of your realizing how important sense of smell is, you talk about it even at the TED Talk. Tell us a little bit about that talk, because you become a fellow also due to this particular topic, and you did a very good job with that talk. Share with us that experience.
Absolutely. So, in 2024, I became a TED Fellow, and I had the opportunity to really give like a TED Talk, really focusing on why smell matters more than you think.
Right.
And during that time, you shared about your dad and the story about your dad. And similarly, I have a similar story with my mother-in-law, who is a wonderful chef, and you'll hear this a little bit more on the talk. We'll share the link for you all. But wonderful chef. But one of the things that we started noticing was a change in her cooking.
I
right?
see.
So she would add more salt and more sugar. So now all of her cakes, which were delicious, are extremely sweet. And a lot of like her other meals were like super salty, right? And she wasn't noticing this. And I remember telling my husband, I said, something is off. So I brought us one of the scratch and sniff tests, give it to her, and lo and behold, she had hyposmia, which is a reduced sense of smell.
Reduced sense of smell.
Till this day, this was the only time where her sense of smell has been measured. But that particular observation led us to going to different doctors, as you mentioned, neurologists and different doctors. And later on, we discovered that she had frontotemporal lobe dementia, which is the same dementia that was diagnosed by when Bruce Willis was diagnosed.
Right, right.
So
we didn't even know that's another side effect.
Yeah.
Or
an early sign.
May I use the word biomark, right?
Yes.
It's one of the biomarkers of these degenerative conditions of the brain.
Yes.
That is something that you mentioned in your talk as well.
Yeah, and it's not really like to create alarm in terms of like, oh, if I can't smell well, this is going to happen to me. But it's more of like awareness, right? I often like to think about our nose, and this is one of the things that you mentioned when you shared the training. Our nose is also like, think about the olfactory bulb as a muscle, right? You need to exercise it. We think about sommeliers, right?
Right.
Wine experts. How do they get so good? It's because of training. Similar to, it's a different industry.
It's like training.
But it's the same as your industry.
It's like a weight exercise.
We need
it's like being able to tell the difference of different shades of yellow.
Yeah, we need to be able to train our nose as well. So, I often challenge, and I challenge you who is listening right now, did you stop and smell your tea or your coffee this morning?
Right.
Right? When you are cooking and getting the spices out of the cabinet, do you stop to really smell the spices, or you just assume that they all smell the same? Right? So I think that that's an important thing as well. So one of the arguments on the talk is really to create more awareness about why is it important, but also to think about why isn't it embedded in clinical practice.
Right.
Right?
So it's really raising questions as well as awareness. But I'd like to follow up with your comment about your mother and mother-in-law and my dad. So what do you think is the percentage of population in our country that actually have some impaired or completely loss of smell?
Well, so the thing is like, some of the data that we had initially was part of like, we call it is the ENHANCE study, which is a long-term study that has been conducted by the Center for Disease Control, the CDC.
Right.
So back, like before COVID, it was like at least 1 in 4 people will have a smell disorder. But after COVID, we really don't know what that number has increased to. And again, one of the biggest things that we can also argue is that we have no baseline. And this is why we've been talking about the importance of a smell test, right? Mm-hmm. And also smell screening, because we need baselines, right? How do I know that this number is good for you if we don't know what it was before?
Right.
So when COVID, what happened is like you had people who lost their sense of smell, and recovered within weeks, but we don't know to what level of recovery.
Right.
Similarly, we had people who recovered, but then a few weeks later developed what we call parosmia, which is distortion on their sense of smell. So you can think like a banana now smells like sewer.
Right.
Right.
Oh, how painful that
which is really horrible.
Right.
And then you have
for food lovers, for anybody who enjoy
fragrance.
Fragrances. That would be a disaster.
Right. So like all of a sudden you smell something and it's just this really distorted smell.
Right.
So in terms of going back to your question of like what percentage, we know it has increased, but we don't know to what level. So one of the key things that we need now is a study that actually is looking at a newer prevalence. So a follow-up study with potentially with ENHANCE follow-up study where we can actually have actual measurement, right? I mean, we need the test to be done. But I think one of the other arguments that I have is that at least we need to ask people, has your cooking changed?
Right.
Has anyone said that, all of a sudden your food tastes more salty or more sweet? Or are you putting more sugar?
Or how about
on your
let's
tea?
take another approach to not just taste, but smell.
Yes, of course.
Have you noticed that there are people when you go into the elevators with that smell very, very strong with their perfume? They just seem to have such a strong, they need such a strong perfume. And oftentimes we take it for granted it's a personal preference. But perhaps that's not the case. Perhaps they just can't smell it. They need a lot more than other people.
That's a good point.
Right?
That's a good point.
Or similarly, people, I hate to mention it, but you go into an Uber and you smell that person, body odor, so strongly. Do you think they actually are aware? Maybe not. Well, let's not judge, but is that a possibility that they already lost some sense of smell, so they didn't know they smell so bad?
Well, this is we don't necessarily know, right? I mean, there's something that we call olfactory habituation.
Right.
So this is why sometimes you can be burning this candle. You smell it at the beginning, and then after that you can smell it. I mean, in terms of individual, like an individual changes, I mean, I don't necessarily know where that stands in terms of the evidence, but there could be indications that things are changing for us.
Right.
And sometimes those changes are noticed by people close to us instead of us for the same particular thing that I mentioned, which is olfactory habituation.
Right.
There's something else that we also call olfactory blindness.
Blindness, right.
Right. So we need to also think about those individual changes and that are happening to people. And, one of the things I often hear about, and I know you're a dog lover, is that, dogs can smell better than humans. But when we think about dogs are running around and they're smelling everything.
Yes.
We don't.
They spend their time.
They spend their time
They're focusing. And they enjoy.
Exactly.
Yeah, they enjoy.
But we can train ourselves.
Right. So you and I are really strong believers of a baseline screening test and smell test and developing a body of evaluation tools, not only for consumers, but also for professionals. And to that end, we should congratulate ourselves because one of our papers just got published.
Yes.
And I need to read it because it's so exciting. I was invited to join this research, so thank you for including me. This paper that was just published last week by the Frontiers in Allergy, which is part of the section of biology, it's titled Point of Care Smell Testing, Evaluation of Olfactory Functions. Yeah. We were just talking about the newly published paper regarding smell tests. Give us a little bit more detail of what that paper is about.
Well, and congratulations to you on your first academic paper. So this particular paper, where we focus primarily, it was a narrative review where we assess and looked at all the tests that are available to date, both for adults and pediatrics, and really try to summarize, what were good screening tests and which were the ones that we can use for diagnostics, right? And where the evidence is. And then how do we actually have clinicians, this is primarily for clinicians, how can clinicians decide what test to use? Because we've been talking about, yes, we need to measure the sense of smell, it's so important, but we need to be able to give clinicians the right tools, right? So when you go to the doctor, they can do a screening test, and if something is off a little bit, then they can say, okay, we need to do a more in-depth test. So in this paper, we really cover a lot of that ground, and then we really discuss, what is the feasibility of using this particular test in clinic? Because we know, for example, a primary care visit, sometimes it's only 15, 20, or 30 minutes, and then we are asking to do more tests. So what are some of the things that can give us a quick answer and then signal when to refer to a specialist, right? So that's one of the things that we discuss in this particular test that was published in Frontiers in Allergy. So it's really available. I think we'll put the link available for everyone to see, and like a lay summary of that particular paper. But that's one of the things we wanted to do.
And what is the discovery at the end of the paper?
So one of the main message at the end of the paper is that, depending on the condition that people have, like that we are thinking that individuals have, which particular test or battery of tests do we need to do? And as a clinician, right? So that's the primary message, is that, this is the test that should be selected for these particular conditions. For example, if we are thinking that someone is a neurological disorder, we need a more in-depth test, like the sniffing sticks that measures different dimensions of smell.
Such as
discrimination.
And the discrimination refers to, for example?
So for example, like when I give you a smell and a blank, can you tell which one it is? Which one has a smell? Identification, which tells us, okay, if this is banana, can you smell the banana?
I see.
Right? Or intensity, right? That tells us how much, or like a threshold, how much of that particular scent can you actually perceive? And then what we do is have a composite number that tells us whether someone is normosmic, has a normal sense of smell, or is hyposmic, which is a decreased sense of smell, or it's complete, or it has complete anosmia, which is the word that most people heard during COVID. Right.
So you could be born with that condition.
Right. So this is what we are talking about right now, is acquired anosmia.
I see.
Right. That is happening because of something. But there are individuals who are congenital anosmics. Right. So we can think about Ben and Jerry from Ben from Ben and Jerry's ice cream. Right. It's an individual that's born without a sense of smell. Right. So that means that that particular person probably not able to distinguish different scents, but they're actually able to perceive things through texture. Right. So, and one particular thing that I know we've been focused on smell, but a lot of what we describe as taste is actually smell.
Exactly.
Right. And I think that most people don't know that. Right. So if you lose some of us lose our sense of smell because we have a cold, and all of a sudden you see that your chicken soup doesn't taste that great, right? But it's because of that, like of what's happening at the time. And then it recovers, right? And you're able to taste your chicken soup again. But that, a lot of what we call taste is actually smell. Flavor it's a combination of smell, taste,
Right.
as well as what we call chemosthesis, which is the
Right.
burning. You know, like if you like chili peppers, that ability,
sensation.
that sensation is not taste.
So
it's
essentially,
chemosthesis.
you have a taste of sweet, you have salt,
Yes.
you have spices, which is the chili pepper.
Well,
you
that
have
would
sour.
be chemosthesis, yeah.
Right, there will be sour,
Sour.
there will be bitter, and maybe there will be umami, which which is more from the soy sauce and some of the fish
Exactly.
and seafood, which is very interesting because we know about the degenerative conditions that the sense smell, the loss of smell can come even 20 years before that. What are the other health conditions, and how many health conditions will have something to do with decline of smell?
So there's a very elegant paper that was published, I think, about maybe 2 years ago, that shows how a decreased sense of smell or smell loss has been associated with over 130 diseases.
130?
Yes, so things like, and depression. We think about autism, right? Like, so we think about kids with autism becoming picky eaters, but they're also like, there's changes that are happening in their senses of taste and smell as well. And so many other conditions. Alcohol, which is what I study, right? Alcohol use disorder.
Right.
Obesity. Right? There's so many conditions. Different viruses, right? Of course, we all know about COVID, but there's other viruses as well. One, we're currently looking at, I have gotten reports of individuals that are in Guatemala because they have dengue. For example, they have endemic dengue.
Right, it's a tropical condition, from mosquito
bites.
Right.
And one of the things that they're reporting is actually smell loss as well.
Because of the nerve system being impacted.
Potentially. So one of the things that we're doing is actually thinking about launching a study there to really understand what is happening when these individuals who are having dengue and also losing their sense of smell.
So I have a curiosity regarding Ozempic. And I know
I knew this question was going to come.
I know this is coming up. I know there's a mechanism to suppress your appetite. So in my view, that has to do with sense of smell. Do you have any study that has been done regarding those who's on the medication, whether they have a decline in smell and taste? So
that we're calling it, I know that some of you might have heard about the Ozempic tongue,
right?
But also the Ozempic, you haven't heard about the Ozempic tongue. These individuals who are taking semaglutide or Wegovy or Ozempic, whatever, where they have like this, there's a physical change that's happening to their tongue and affects their ability to taste, but there's also
what we call I know this word because one of my sons suffered from acute sense of taste. We call them super tasters. They have glands they have more taste gland in their tongue. Does that sound like what they have?
Well, it's something. I think what's happening is like there's not like they're getting more taste buds. It's like because we have a number of taste buds that we knew.
Right.
It's like there's a physical change that's happening in their tongue.
Physical
right?
change.
But I encourage people to look at the photo, and we probably can put a link.
It's like a barrier. Is that a barrier? Possibly?
I cannot really describe totally what it looks like. It's very interesting. But when it comes to smell in particular,
right?
We need to think about how these drugs work, right? They work on the reward system, right? So when we think about the reward system, we also need to think about taste and smell because it's all connected,
right?
Right?
Right. It's a satisfaction of food.
So there's not a lot of studies, unfortunately, right now showing, what happens when individuals take Ozempic, but there's a lot of anecdotal evidence. There's a lot of people that will come, especially patients that will come and say, I can smell my perfume in the morning the same way. My coffee smells differently. And I think that's exactly what you're talking about.
Right.
So we need actual empirical studies. We need a study that's putting individuals and kind of measuring. We talk about measurement.
Before and after.
Before and after.
It's the baseline you're talking about.
So we can actually see, okay, what is happening, what is changing, right? And maybe have some of these individuals go into an fMRI in a scanner and see what is going on.
So before even that, as you know, we have been working very fast and furiously for the last 2 years, right?
You have.
Since the very beginning of Blueme was to launch our smell test because of the way that our industry tests and train the experts. This is not someone that just happened to like to smell a green tea. They are making it their lifelong profession. So we use fragrance families to evaluate.
And I think that's brilliant.
Right. So fragrance, as you can imagine, can be broken down into over 10 families. Imagine the families of lemon is very different than the families of sandalwood. The families of vanilla is very different than the families of, let's say, another white floral, right? The vanilla is not a floral, it's a seed, and it's very, very particularly grown in 2 regions of this world, and they are very unique in their way versus the flowers of roses or lavender. So in our industry, we separate them into families, and that's how Blueme's focus is not only on the ID, but what kind of ID. We want to culturally represent all the IDs of all the fragrance families so that there's no discrimination for people who never smell lavender in their life. They have another choice in floral, or there's no discrimination for someone that have never smelled ocean because they live in the desert. So environmentally, we can compensate for this kind of cultural diversity. But we also look at something that I don't think any smell test ever asks, which is, what does this fragrance or aroma make you feel?
And I think that's a very good question. I mean, I think, so congratulations on your study. I know you have a study that's ongoing right now, so I hope you get to share with your audience too.
Very exciting,
And I think that it's precisely that. I think one of the things that, after talking to you more and learning this other area, right? I mean, we know what we know we need medicine and science. But learning from industry, and as you said, there's so much we can learn from each other. Where learning about this family of odors, right? And then being curious when we say an individual is have lost their sense of smell. Have they lost completely, or is it a family that is particularly affected? And the very exciting thing is, like, I think it was back in April or May, there was the first study that was done by one of our colleagues, Bob Dada, who you met as well on the launch of the center. For the first time, the sense of smell has a map. Which is really, really exciting, right? You can think about, the map when it comes to pain, right? Like if you go to a chiropractor, they have lines. Right now we have a map for smell. I think this is such a fun, this is like one of the biggest discovery to date in this field. And I think when I think about the contribution that you all are making in terms of this family of odors, and I think about this map, it might help us really pinpoint, is it this family? Is it this particular receptors that are affected?
This particular zone in your brain that is, is losing its working condition. And best of all, I know we're running out of time, will training help, right? We go back to how we train our own when we take them from universities and we say, we're going to train you to be the nose in the future. And we know the trajectory of how they can increase the ability to tell not just a citrus, but what is a tangerine from Florida versus a yuzu from Japan. They are in the same family, but there are different nuances.
Will training help? I think training helps. It depends on timeline, right? So if we catch things early, so we might be able to use smell training. So again, it's going back to the idea, of thinking about the olfactory bulb as a muscle. We need to, and one of the areas that regenerate very quickly is the olfactory receptors, right? The olfactory neurons. So the olfactory neurons in specifically. So if we have people train early, right? The idea is not to wait until you have a complete loss. If you lost everything, will training help? Most likely not, right? And that's where the evidence probably sits.
Very exciting.
But if we can start paying attention, being mindful about, again, if you're drinking your coffee, not necessarily just chugging down the coffee, but really savoring it and smelling it, right? If you're burning your candle, you know, is the smell the same today? How does it make me feel? Really being intentional. And that's what we talk about well-being, right? When we start thinking about centering ourselves and really thinking about how scent is really connected. So I'm very excited. I don't think I mentioned this to you, but I just got my first book contract with Hay House, and this is really what we'll be talking about, is the connection between smell and well-being in general, and just thinking about why is it so important and why we should be paying so much more attention. So I'm really grateful for the work that you're doing and your team is doing, and the partnership between industry and science to really think about how we can learn from each other.
I couldn't agree with you more. You know, I go back how my dad could have lived a very different last 20 years of his life had we intervened earlier, had we taken him to Johns Hopkins, for example, has one of the best neurological department and one of the best for treating Parkinson's. Had we taken him there, had we given him training for smell, how much more we can have him around. He used to play basketball. He was a very fun-loving man that is always out and about. He was wheelchair-bound and bedridden for the last 20 years of his life and not able to go anywhere and enjoy the food that he always enjoyed. So it makes such an important mission for me. You know, I sold one of my business a long time ago. I was going to just really retire and enjoy life. But COVID is a catalyst that make me realize there's definitely unfinished business.
I'm glad you didn't retire.
No,
we get to work together.
My family is going to really be on high alert if I stop working, because they will ship me somewhere to work. So I'm surrounding myself with scientists like you, doctors that truly care about this, because almost all of us have someone in our life that suffers from those degenerative conditions. As we live longer, we no longer want to just live longer. We want to live better. Yes. And this is about longevity. This is about well-being. It's also about well-care. It's not health care, it's well-care. You and I and everyone else have control.
Yes.
And that starts from slowing down and smell the candles, smell your soap, smell your coffee.
Your shampoo.
Your shampoo. Make sure you let the people that seems to not be aware of their body odor, ask them a question. Do they realize that this is not being intrusive? This is about being kind, because we need to take care of each other.
Thank you so much for having me.
Thank you. What a wonderful way of ending this podcast. A new book to be launched.
Yes, very excited.
Everyone, see you, and we will see each other in the next episode of Blueme Smell the Zen.